Hey everyone, Dr. Charlie Johnson, physical therapist here, and in this video I want to talk to you about hip bursitis, what it is, what it isn't, and then why most traditional treatment fails. And when I say traditional treatment, everyone out there is telling you to stretch, doing pigeon poses, figure 4 stretches, IT band stretches, you know, the 3-way stretch with the rope where you're doing a hamstring stretch, out to the side, neutral, in. Right? And it's just going to, in 95% of cases, make things worse. So, first things first, what is hip bursitis? So, if you're standing, and this is kind of you from the side, here's like the crest of your hip, and then the hip socket and the point of the outer hip bone, the bursa of the hip, you'll be diagnosed with trochanteric bursitis, is located right on the point of the hip and just behind it, all right? So, if you have true hip bursitis, then you'll be tender on that area. You will, sometimes we call this a jump sign. So I used to work with surgeons, and you lay on your side and they take their thumb and they jab it right behind the point of that bone. So find the bone and go right behind it. I'm not recommending you do it, but that is where you will be tender. So laying on your side will be tender, right? So side lying, maybe it keeps you from sleeping or whatever. Tender, so we'll call it jump sign, JS. The next thing, often, because it's actually a bursa problem, if they inject the area, the injection is often painful, but a lot of times you'll get relief because they're putting it right in the area of the inflammation and pain, and that will reduce it. So, positive response to injection. Again, I'm not recommending you get one. I'm just saying if you have, then it should help. And let's see, what else? What don't you have? It's just as important sometimes when you think of diagnosis to understand, well, what is hip bursitis not? And then it leaves it as an option, right? So you should have no back pain, no low back pain. So there shouldn't be pain up here, and they definitely shouldn't seem as though they're linked. So if you do have some, okay, but they shouldn't seem linked. You shouldn't have any central cheek pain. So a lot of times I treat a lot of people with like piriformis problems, sciatica problems, things like that, back problems. And if you have pain upstream here, then the structures in the back can cause signals to be referred towards the trochanter. By the way, if we draw out from the back, these are the bones of the lower back, there's your hips, there's your knees, there's your feet, right? This is where the trochanter is. We're looking from the back to the front. The sciatic nerve, so you have multiple branches that come out, right? And the sciatic nerve goes right around the greater trochanter. So, you should have no low back pain. You shouldn't have pain anywhere really else besides this area right behind it. That should be really the only tender spot. You shouldn't have central butt pain. You shouldn't have, so no back pain, no butt pain, no leg pain, numbness, tingling. So you shouldn't have sciatic-like symptoms because the bursa is a bursa. It's not a nerve. It can't cause those types of things. And what that means is that if you do if you stretch, lay on your back with a rope and you stretch that leg right in front of you, you should have good flexibility and it shouldn't shoot zapping pains down the leg. So we call that a straight leg raise. If a nerve is part of the problem, then it's going to be sensitive. In a bursa issue, the nerve should not be sensitive. So you should have, you should have a negative straight leg raise test, we'll call it. Go ahead if you don't believe me. Stretch the one hamstring, stretch the other hamstring, and if they both go pretty well, it just feels a little tight, but the motion is good and it doesn't reproduce your problem, then it's still, it's possible it's a bursa problem, all right? So just get that, you should only really have pain in this area. I guess you could have on both sides, but that's more suspicious. Really just usually one side, right behind on the side when you poke it, right, or when somebody else pokes it, ooh, really hurts. It shouldn't go anywhere else. If it's truly that problem and you have an injection, it should help. No back pain, no butt pain, definitely no numbness, no tingling, anything like that. And that is sort of, what hip bursitis is and what it isn't. All right, now that being said, most people who have this problem think or have been led to believe this. My hip hurts and it feels tight, or maybe the therapist or chiropractor or massage therapist told you it was tight, and it hurts, it's tight, therefore, right, it must be tight. And if something's tight, what do you do to make it less tight? stretch it. And, if I stretch it and it becomes less tight, or I increase, another way to say is I increase my motion. So you think motion is the problem, it's tight. So if I stretch it and I increase that motion, then I should feel better. Except what happens is you get to the end of this, and 95% of the time you actually feel the same, but actually even more often you just feel worse. Stretching just continues to aggravate this thing because it's a good hypothesis and it sort of makes sense, right? And again, not your fault likely because you've probably been led to believe that, but consider that your hypothesis might be wrong. So I'm going to review here something I call a figure 4 stretch test to actually prove whether or not you have a motion problem. And if you don't have a motion problem and you find that as you go through this figure 4 stretch test that you're actually more loose or symmetrical, so you have the same motion or you have more motion on the side that hurts, then are you really tight? Or have you just been thinking that you're tight and you've been stretching something that doesn't need to be stretched? So here it is. All right, so here is the figure 4 stretch test. And the purpose is to determine, are you, either loose, so do you have more flexibility on the painful side? Are you symmetrical, do you have even motion? Or are you actually tight? In which case, your hypothesis of trying to stretch might, I say might, make sense. But if you're like most people who've been trying to stretch and you still have not gotten the results that you're looking for. So that being said, here it is. What you're going to do is there is no norm for this. It's just whatever you find right compared to left. So if you have pain on your right side, for example, let's just say, and that's where you've been diagnosed with, bursitis or something else. And the reason I say something else is because a lot of times pain in this area is very diagnostically muddy, meaning depending on who you go to see, you'll be told like 10 different things. So you'll be told that you have piriformis syndrome, a back problem, bursitis, sciatica. All of those things are game, right, when it comes to a label for pain in or about this hip area. So that being said, check the good side first, and then we'll go check at the painful side. So we want to get a sense for how is the good side moving and what does it feel like. So here it is. This is the figure 4 stretch test. Pretty simple. It probably looks like the figure 4 stretch that you've been doing. So get in this position and see, how well does this leg move? Meaning what is kind of the motion on this side, the pain-free side, and how far does the leg flop towards the ground? All right. Then what you're going to do is go to the painful side and do the same thing. And you're going to see again, what is the angle here? How far does it fall to the ground? And what does it feel like? And you'll get a sense of that. And then there's either, there's one of 3 potential sort of results from doing this test. Either you're loose, you're symmetrical, or you're tight. So what would loose look like? Loose would look like this. Let's just say this is my pain-free side. So I put this up here and I can get to about this degree of motion. There's a little tightness in my hip, but no problem. And then I compare that to my painful side, and the knee goes much further down towards the ground. There's more flexibility there. You're loose, in which case you're not actually tight. You think you're tight, but you're not actually tight. You've been stretching something that doesn't need to be stretched, and that's probably why it's not working. So that's loose, all right? Another result could be that you have symmetrical motion. So you test this, you got this much motion, all right? It's about here, right? And you test this, and it's about the same. So there's no big difference. It's hard to tell. Is it tighter? Is it looser? It's pretty much, we'll call it symmetrical, the same. In which case, again, it does not make sense to be stretching because if you have the same amount of motion, left side versus right side, pain-free versus painful side, why do you not have pain on both sides? The final response or possible outcome of doing the figure 4 stretch test is that you're truly tight. All right, so here's your pain-free side, moves pretty good, and your painful side is like, stuck, really stiff, a little painful on the outside of the hip, hard to move. Now, if you're truly tight, chances are there are other things going on that are limiting your motion. Most likely things like, hip osteoarthritis or something else within the hip joint. So again, I'm not here to diagnose. It doesn't really matter at the end of the day. Just get that you can have one of those 3 responses. And even if you are truly tight, the painful side doesn't go very far. Chances are you've been trying to stretch. Your hypothesis makes sense, right? It hurts. I feel like I'm tight. And my problem is a lack of motion. So if I just stretch and get more motion, then I'll have less pain. It kind of makes sense, right, in the tight sort of response or outcome. But if you've been trying to stretch and now you've disproved that theory and that, man, I've been trying to stretch and it actually is making me worse, you're getting the opposite of what you want, right, then consider that stretching, even for something that appears to be tight, is not the solution. So go back, kind of rethink that hypothesis, and realize that tightness is mostly just a sensation. And a lot of times you haven't gone and actually checked to see, is it truly tight, or is it actually loose or symmetrical on that side. You'll be banging your head against the wall and you'll be stretching and getting nowhere. So consider that the first step to healing is to stop stretching and to stop putting yourself into stretchy positions. More on that later. This is Dr. Charlie Johnson, physical therapist. Hopefully this is helpful so you can see, does what I'm doing or the treatment that I've been getting, or what is wrong with me and what I've been led to believe is potentially the problem, is it actually the problem, and does it actually make sense? And is there another way that we could sort of reconceptualize this, flip things around and think of it differently so that you are not constantly aggravating the problem? Because again, if you're loose, symmetrical, or tight and you're stretching that painful side, consider that the thing which has been recommended to you, as the solution to your problem becomes the thing which keeps you from healing.